Gordon Garrett is a local North Charleston attorney, a resident of North Charleston, and now a candidate for Charleston County Council's District Free seat, which covers parts of North Charleston and Mount Pleasant. I speak exclusively with Gordon for this edition of Quintin's Close-Ups, and if you haven't already, subscribe to my YouTube channel and follow me on social media. Gordon Garrett, welcome back to Quintin's Close-Ups.
Hi, Quintin. How are you?
Oh, I'm doing great. And yourself?
I'm doing good. Thank you.
I understand, obviously, you are a notable attorney and well-known and well-liked in North Charleston, and now you are a candidate on the Democratic side for Charleston County Council's District Free seat. And I know the primary is coming up in probably 2 weeks. You said this recently on Facebook a couple of months ago. You said this quote, "I'm excited to announce my candidacy for Charleston County Council District Free. To all of my supporters, please reach out to anyone in our district and let them know that this campaign stands for an open and accountable government, finding proven solutions that fairly help all of our residents, and moving our community safely into the 21st century." What are the concerns right now in District 3, Gordon?
Well, when we look at the economic diversity in this county, you've got people in this county who are extremely affluent. You've got a healthy, vibrant middle class here. You've got a large group of people in the food and business and the tourism industry. You also have people who live in this county that don't have access to health insurance. They don't have access to Medicaid. They don't take full opportunity of our public educational system. Their children aren't fully engaged. And one part of my campaign is focused on what the long-term costs to everybody are. What the long-term cost to our entire society is when some people don't have access to medicine, they don't have access to healthcare and health insurance, and what an effect that can have on everybody. And addressing people in situations that don't have the educational access and the health insurance access, to show everybody what a positive benefit providing that and helping people have those basic minimums in their life is. And I think our whole society operates much better when we don't leave people in that situation.
If you were on Charleston County Council today, let me go to the old Naval Hospital. What exact services would you like to have in that particular hospital for your district?
That Naval Hospital was built by Mendel Davis. That was and Mendel Rivers. They both contributed to that at the time. It was a state-of-the-art hospital up there. It preceded the Naval Reserve Hospital, where my mother was born, on the naval base. We built Trident Hospital in an effort to serve the north area of Charleston County, as well as Berkeley and Dorchester. That's the Trident of that name. That hospital was supposed to be used for county services. One example of a county service that we could offer is mental health counseling and drug and alcohol counseling. Those offices were supposed to be located in that hospital. And I think that building has been purchased recently. I don't know the state of what that lease would have been, because I'm sure you're aware of the lawsuits that involved those properties. But if that's still on the table, I think it may get turned into apartment complexes or something like that. But I would, that aside, I would be very open to that area of town between North Charleston and downtown Charleston hosting some of our county medical facilities. I think that's an excellent idea for development down there.
And, you talked earlier about the lack of access for healthcare and whatnot for those folks in District 3. What exactly do they need now from that vantage point?
Well, right now we've got a global pandemic that's raging. You've got people who are afraid to go to the hospital, who feel that they may be overburdening the hospital system. There may be people who don't want to go and get tested because they're afraid that they're going to get some bill for several $1,000s for a COVID test. The county needs to be able to offer solutions to that. We need to be able to look towards a vaccine if and when it's available. How is that going to be rolled out? What is the county's role in doing that? I mean, you can't just give it to people who've got health insurance. I mean, that's not a smart way to handle this. We need a uniform method to ensure that as medicine and vaccines related to this virus come out, that we have a fair and equitable and efficient way to do that.
What method would you use right now?
I'm sorry?
What method would you use right now?
Right now, the county has a duty to the county employees. That's our first and most direct duty. You've got a $600 million budget, which is mostly going to salary. I mean, that's the entire solicitor's office, the sheriff's office, the public defender's office, the jail, and all of that. These departments are going to need reforms with their PPE. They're going to need budget for their PPE, to buy masks, to buy gloves, so that they can come to work and they can do their jobs. I mean, county council oversees the backbone of county jobs. And if we can have our employees set the example for what's safe, maybe private businesses will follow us, maybe other local governments will follow us. But I think the sheriff's department, the solicitor's office, they should be the number one equipped frontline people. There's so many county offices that form the face of our county, and they need to be protected, and that's what I would do.
What in the Charleston County budget would you cut to have money for taxpayers as well as the first responders?
I don't necessarily agree that we need to start cutting departments. We have money that we can apply to for federal grants. We can apply for a number of other ways to acquire this, as well as the state having emergency funding for these situations. We need to be exhausting all of those options before we talk about taking money away from other departments. We need to be making sure that the tax revenue that we're bringing in right now is being put in the best possible way, and it's not being wasted. So no, I wouldn't look at one department at the county and say, you're going to bear the brunt of this virus.
How much money would you fund for first responders?
I mean, I know that, my wife has a small business where she spent, close to $1,000 for 3 employees. And now you're talking about a payroll expense of over $600 million. I mean, you're talking in the 5 to tens of millions of dollars of equipment that our employees are going to need to go out into the field to be able to have safe contacts and do their job correctly. And hopefully after we have a vaccine, that does not remain an ongoing overhead cost of the county. And that's why I think that we look towards these emergency funds and emergency reserves to pay for this, because this really is the emergency that we need to pay for.
Now, once you head into that emergency fund, how would you replace that money?
Well, we have to gradually build it up over time, and you have to allocate, a percentile of every budget of making sure that the millage is paid back and we pay our bills. I mean, if we're not filling our reserves back, if we're not paying our bonds, we're not doing that is the function. That is the core function of county government, to be prepared for the next emergency and to pay for this one.
And as you know, the tax revenue is the way the government is able to function. How much tax revenue has District 3 lost over the past 4 years?
District 3 has, as a population, grown immensely. It contains some of the biggest businesses in the county. District 3 has also been changed in the past year to include a large stretch of Mount Pleasant, which wasn't the case prior. And this district has changed so that it's a large swath of North Charleston and as well as Mount Pleasant. And So I'd be a little cautious about saying how the economic situation has grown or expanded when you've seen, the size of the district change as it has. Overall, our county has grown immensely. We're still see a period of gentrification, which is causing people who are pushed out of well-developed areas of the county and being pushed to move into areas of District 3, which has increased a lot of problems. But I see it as an opportunity to help fix them and help solve them.
What comprehensive plan do you have to slow down gentrification in District 3?
Right now, I'm worried with the economic recession that you're going to see a lot of tax sales. People who cannot afford to pay their lump sum property tax at the end of this year. And that's going to start to hit in January of 2021. One of the biggest drivers of gentrification is people who have owned their homes for generations, who have inherited property, of missing these tax payments. That's something the county can do something about, and we can save homes. And I think that we need to look at a moratorium on tax sales and say that the county is not going to take people's homes. I think that we need to look at situations where that could be forgiven. I mean, you can't just hit people with 2 tax payments, tell them that they don't have to make their January and then come up with double the amount when it's due. So I think that we need to maybe try and create a fund based on a bond and see if we can forgive some people who are not able to make their tax payments this year and allow them to hold on to their family homes. I think that would be something we could do.
And if you're on a Charleston County Council, that is, and if this moratorium were to be passed, how long should that be in your mind?
2 years.
And you talked earlier about obviously saving homes. How many homes do you want to save in District 3 when it comes to gentrification and other issues?
Well, we want to have a community where people can live here and people can work here. I think one thing that you see with the development of Latson and with Berkeley County and some of these subdivisions is that people are beginning in some economic classes to be forced to live 2 hours away or an hour and a half away and drive every day down into the city. I think that's a serious problem, and I think that if we can allow housing, a big conversation we need to have is the Charleston Housing Authority. Is that something that should remain a separate quasi-government institution? Or have we gotten to a point in our county where the county needs to be directly involved? The county government needs to have funding for affordable housing.
Speaking of affordable housing, what tax credit would you use and ask the county for in regards to this issue?
When you look at the 2 Charleston County housing authorities and I think the roughly 200 properties that they manage, the large building on Mount Pleasant Street is an example of how poorly our society turns out when we don't invest in affordable housing, when we don't invest in public housing. I would fully support the county investigating setting up a permanent part of our county government that owns public housing, that rents it out. I would support laws that would allow landlords to receive discounts from their property taxes if they would lower their tax, the rents accordingly in situations. I mean, these are things that need to be investigated a lot further. I think they're important. And I would support investigating both of those endeavors.
And you talked earlier about Mount Pleasant Street, where the Joyce and Floyd Manor project is located. Obviously, you heard the stories about bed bugs and rats and mice and roaches allegedly in the building. What should be further investigated right now in your mind if you were if you were a county councilman, that is?
I would look at us. I think what needs to be investigated is a public housing situation like the city of New York has, where it owns hundreds and thousands of properties. And people who are not necessarily poor, people who are of middle class, people who are artists, people who are retired, all have the ability to qualify and live in New York public housing. What the amount of infrastructure that they've developed over the decades of them doing that is now a huge real estate holding. That's what Charleston needs to look at, is the county going to begin to oversee something like Joseph Floyd Manor to make sure it never falls into the condition that it does, and have the assurance of the taxpayer that it will never fall into those standards again.
And let me jump over to Mount Pleasant since we're talking about Joseph Floyd Manor in that area. Obviously, as you know, there's a big talk about widening 526. How should the county go about that right now?
The I-26, 526 interchange was supposed to have been replaced about 20 or 25 years ago. It reached capacity. The amount of traffic that you see when you're going up 26 at that interchange is too much, and we've got to do something about it. The money's been allocated for it, and it's going to be, $100 million road project. That's something that the state has agreed to take care of. And it needs to be done. It's got to be done. What the cities need to be thinking about, and what Mount Pleasant needs to be thinking about, is because the state is paying for these big projects, they don't have the money to be maintaining the local streets, both in Mount Pleasant and both in North Charleston. And I think one thing that we need to figure out as we go forward are what local streets is Mount Pleasant going to take care of? What local streets will North Charleston take care of? And what streets will the county take care of and maintain and keep up to very high standards? And so that we can begin to share the burden of our roadways through our local and state governments.
And how should the Charleston County government take care of, say, for instance, widening Long Point Road?
I think from the county's perspective, what roads are used to connect the municipalities? What are the major thoroughfares that are not local streets, that are not state highways, but are the large, exactly what you're talking about, something like Long Point Road, that's such a big thoroughfare that should be the county's responsibility to determine if it's necessary, to determine what the funding requirements are, and to go ahead and do something like that.
And let me turn over to the islands and obviously West Ashley. Obviously, there's still the debate over the expansion of 526 there. What in your mind did the taxpayers agree to, and what did the taxpayers did not agree to in your mind when it comes to the 526 expansion?
The state of South Carolina and the State Department of Transportation is not paying for the extension of 526. The state government will pay for the renovation of 526-26 interchange, but they're not going to build new roads for us. So that money has been put together by the city and by the county, and to have matching funds in order to do that. It's going to massively change the people on Johns Island's life. I don't know. I think 6 months ago, with the way that things were growing and without a lot of other priorities, it was something that we needed to have a sit-down debate right then and there about. With this virus happening, with our lives and budgets being pulled out from underneath us, I don't know that right now is the time to dig into a giant new road project.
What's the preferred alternative for the 526 expansion in your mind?
Alternative transportation, or more efficient use of our roadways. I think as you begin to see, more automated driving, which is going to take 5 or 10 years. You're seeing the more efficient use of our existing roadways. When you talk about building an extension like that, that's a 30 or 40-year project. And we need to look at, where is our transportation going to be in 30 or 40 years? Already, this recession has put many more people working from home. It's put children out of school. We need to get through this, and we need to look at what our needs are, because they're going to be very different for a very long time after this virus versus what our needs were before.
How many people in District 3 have been tested for the coronavirus in your mind?
The rate that we're testing, and it's showing that there's more testing there's more cases that are showing up, but we've not tested a large enough sample of the population to know exactly what percentage of people have been sick or are sick. And there's a danger in combining these antibody tests, which are very different tests than the negative or positive to an active virus test. The state needs to direct the counties to issue many more tests. I think 10% of our population is something that the CDC has been looking at. And only then are we going to be able to have a sense of, is the rate of virus increasing or is it decreasing? And I think that's something we need to really know as we go forward.
And what should the quality of life look like in District 3 in the next 5 years?
I want everybody to be safe and still be here. People are gardening now. People are out on the streets more. People are bicycling more. As awful as this virus has been, it's changed people's habits in really positive ways. And we're using our green spaces more. We're using nature more. We're commuting less, using our roads less, polluting less, consuming less. The government's job isn't to make the future. It's to protect people and make sure that they're safe as we go forward into the future, whatever it may be. And I'm not afraid of it. I think it's very positive. And I think the Democratic platform is a very strong platform that's going to help move our whole country out of this.
And when it comes to the new Charleston County Recycling Center, what exactly should be in there in your mind?
One part of this economic collapse has been our relationship with China. China used to buy our recycling. It used to take all of our cans. It took all of our plastics. As its economy has developed and as its standards have gone up, they're not willing to recycle our trash anymore. And we're getting to a point very quickly that it's no longer profitable to take all of our plastics and put them into big pallets and put them onto container ships and send them to Asia. We've got to look at technologies that we can take these recyclables and do something with them domestically. And does that mean in South Carolina? I would hope so. And I hope that we can develop green technologies that we can do something with the recycling that we do collect in this county.
Gordon Garrett, thank you so much for your time. And again, welcome back to Quintin's Close-Ups, this time on Zoom.
Good to see you, Quintin. Thank you so much.
Thank you.